All right, combination treatment is a mix of ultrasound as well as inner or electrical stimulation. And for this class, we'll be using combo IFC, so interferential treatment. And when we go into the customization, it's going to really matter. Hopefully everybody remembers that 1 megahertz goes deep and 3.3 is going to go more superficial. Hopefully you guys can see that. Sorry. So 3.3, if we're going to work on like a trap, we want to go 3.3 to work on those. Really, we use this stuff for trigger points and stuff like that. So that's really what you're going to kind of keep in mind. For this, we're going to use continuous because we are trying to typically get a little bit of heat into it. Otherwise, if we were trying to do non-thermal, we would go less and use one of those lesser duty cycles as we were looking at this kind of stuff. And then we can go between watts per centimeter squared or watts. Either way, it doesn't really matter as we look at that because notice when I do it, it just says volts either way as we're changing things. So notice we do need to have, because we're doing interferential, the first and second in line as we're doing that. And then notice we'll turn up the stim, and then we will also turn up the ultrasound. And you need to have in mind what kind of ultrasound watts per centimeter squared you really want to have going for the person. And again, it needs to be determined upon what you're trying to set up and do for that person. In general, for this treatment, you would want it to be between 1 and 1.2 watts per centimeter squared. But there's differing reasons for changing it. This is currently set at 8 minutes. It depends on what you're doing for your treatment. If you're really trying to work on the ultrasound side of things, or just working on the muscles and the spasm that's going on. So just thinking about what you're trying to do and why you're trying to do it as you're setting things up is going to be really important. And now I'm going to show you how we actually set up the whole entire thing. All right, we have Meredith set up here, and she's set up for interferential. So if you notice, we want to work on this area to try to get rid of some of her trigger points. So I have these two connected using this lead, and then I have these two pads connected using lead 1. And then I already put down a little bit of ultrasound gel. Remember that you don't need a ton of ultrasound gel. You just need enough that it's going to be able to cover that area. And a lot of people really try to get crazy gung-ho and they put way too much gel. So try to moderate how much you put in. 1, because it costs money to keep replacing it, and 2, it's just a waste of gel, and it can actually make it so that way your treatment isn't as effective because it's having to go through all of that medium. You really just need like a very thin layer of it so that way it can help move the sound waves through into the skin. So everything's still set up as it was before. And what we're going to start with, so notice it's set on stim first. You probably can't see it, but what we're going to do is it's set on E-stim for the intensity, and then I'm going to ask her to tell me as I'm turning this up when she starts feeling the tingling from the pads, okay? And she's actually going to feel tingling with the pads, just like regular interferential. And even though the ultrasound head isn't on yet, I'm still moving it because I get paranoid and it's just good practice.
Okay, right there.
Feeling it?
A little bit.
A little bit? Tell me when it's a good buzz.
Right there.
Okay. So she's at 9.4 volts. Again, it doesn't have to be 9.4. Everybody's different where you're going to be in the pads. Now I'm going to switch it over and turn up the ultrasound part. Like I said, she should start feeling as I do this, the current actually going through the ultrasound head. Are you feeling it?
Yeah.
Is it too much?
No.
Okay.
Yeah.
Right there's good? Okay, so we're at 1.2 on the ultrasound. I'm going to hit start. I think I hit start. Start. There we go. And then what I'm going to do is I'm going to be over, ideally, where her trigger points are and trying to stimulate those particular areas. I don't just hold it still right over the top of it, but the idea of doing this is that way you're not wearing out your thumbs, and this is also more comfortable a lot of times for the patient because you're not applying manual pressure directly on the areas that are causing them pain. And you do want to kind of stay in a small area over there, but also you need to make sure that you've told them what it should feel like for both the interferential and the ultrasound. Remember, you can burn people with ultrasound, so you need to be careful with what you're doing. Also remember, when we talk about BNRs and ERAs for ultrasound, that you can't treat a size bigger than 2 to 3 times the size of your ultrasound head, so you need to be in a fairly small region. What are you feeling right now, Meredith?
It's like tingling and
Okay.
yeah,
And where do you feel the tingling? Under the pads or under the ultrasound head?
under the ultrasound.
Under the ultrasound head. And that's exactly what it should be, and it should be under those trigger points. And you can try to turn it up a little bit, but again, this should be more of a comfortable treatment, not one that's killing people as they're doing it. Okay? Then make sure you shut it off before you start moving things around. Remember, the ultrasound head, if it's not in contact with the skin, you can actually crack the crystal and ruin the machine. So always, always, always hit stop first and make sure the light goes off before removing it from your patient. Clean up the area, check the skin and make sure everything's good, and then instruct your patient. Usually after this, we followed up with stretching and some kinds of exercises to help facilitate those trigger points resolving.